Why don't we go and get started? Welcome everyone to this webinar. My name's Melinda, and I direct Public Citizens Medicare for All campaign, and we're helping all of our colleagues here in Tennessee host this important webinar. And without further ado, I want to turn it over to Stephanie Kang, who will introduce it. But just to give, just on the logistics side, as I mentioned, folks are able to chat. The panelists can speak, but attendees can write into the chat. And if you joined on the phone, if you have questions, you can email them at Medicare-for-all@citizen.org, and we'll make sure the panelists receive those questions as well, and we will follow up with you afterwards. So I'll turn it over to you, Stephanie.
Great. Thank you so much, Melinda. I really can't thank Public Citizen enough for taking the time to invest in our actions and efforts here in Tennessee. Hi, everyone. I'm Stephanie Kang. I'm a native Tennessean, born and raised in Nashville. Have been working in healthcare and public health for the last 10 years, and I'm currently the health policy advisor for the U.S. Congressional member Pramila Jayapal, who is the lead sponsor of Medicare for All in the House of Representatives. And so, thank you so much for being on this call. You know, I think what this pandemic has really shown us is that we need platforms that bring us together, that remind us of our values and unite us in solidarity as we, still maintain efforts and energy around a lot of the things that we've been pushing for the last year. And, I've been working on Medicare for All for the past year and a few months, and I can't help but reflect on how truly different these last few months with COVID could have been if we had had a Medicare for All system. So just a little background, my family, they're South Korean, and I've seen how, South Korea with their single payer healthcare system, they had their first case the same day the United States did, yet they're seeing completely drastically different results. And that's because they're not having to question whether or not they're going to put people over profits. It's simply done, and they're taking care of their people. And also across Tennessee, I'm aware Tennesseans are painfully aware of how broken our healthcare system is. And I feel like, there's just public health crisis after public health crisis in our state. And for all of us who have been working on Medicare for All, we've been doing it because we knew before this crisis that our healthcare system was broken, and that we already had the lowest life expectancy amongst developed countries. We already knew we had the highest rates of mothers and infants dying. We knew that the majority of Americans were one medical bill away from a financial crisis. And so, just to be really clear, our healthcare system was broken before the pandemic, and what this pandemic has done is simply exacerbated all of that fragmentation, all of that brokenness, and really shown a clear flaw of tying health insurance to employment status. And so, this is from my perspective, especially here in Tennessee, it's been interesting just because seeing really clearly how you can't tie employment, something as transient as employment status. I've been helping my mom file out for unemployment. My father, he's an essential worker because he works at a car maintenance shop. And he has a terrible ACA plan with a very high deductible, but he's had to continue working due to his job. And I don't know what he would do if he became sick with COVID. And for myself, I was unemployed for the last 2 months before this month, meaning I didn't have insurance. So for February and March, when the pandemic was unrolling, I didn't have health insurance simply because I was in between jobs. So again, healthcare system not working great, and we've been pushing for Medicare for All. And I just want to also remind everyone before we get started how much we achieved in this past year, because I think right now we have a lot of anxiety. We're all feeling a lot of uncertainty, and we have to remember all of the things that we achieved together because of the incredible grassroots movement that we built. And so just to remember, we currently have 119 co-sponsors, including the incredible Rep. Cohen, who will be speaking momentarily. That's over half the Democratic caucus. So this is not a radical idea. We had 4 congressional hearings in the House when we had never had a hearing before. We had city resolutions passed across the country, including Bethlehem, Pennsylvania, to Los Angeles, California, and hopefully soon here in Nashville, Tennessee. And we just had poll after poll in the Democratic primary showing overwhelming support. We had a recent poll showing 90% of Democrats, 68% of independents have a resounding support for Medicare for all. And so what this pandemic is allowing us is to, one, dream bigger than we did before. It's shown us that our progressive ideas were not really that radical. They were simply the basic foundation we needed as a society to have an opportunity, a chance at a thriving life. And so how these next months roll out, especially in highlighting the need for Medicare for all, in the midst of this pandemic, and building support is going to depend on how well we all mobilize, how well we bring in new people to this coalition, and how well we lay down the groundwork. And so that's what this call is about. We are gathered here because we believe Tennesseans are sick of this patchwork fixes to our healthcare system, and we're going to start demanding for real change, for a healthcare system that works for people and not for profits. And so we have an incredible group of panelists who are going to tell us about what is happening in Congress, on the ground, across the state of Tennessee. And we're going to then come together and really determine some next steps and actions. So just to be very clear, this is not meant to be a one-time event. We are looking to build a sustainable platform that's going to channel all the energy I know Tennesseans are uniquely can be able to bring and produce meaningful, real change. And so to kick off our really amazing panel, I have U.S. Representative Steve Cohen, and he represents Tennessee's 9th Congressional District and is a co-sponsor of the Medicare for All Act of 2019. Please take it away, Representative Cohen.
Oh. It's nice to be with you. Hear me? Good. Dr. King said something about healthcare, or health. It wasn't healthcare. He said of all of the inequalities, the inequality in health is the most inhuman that we know, because the result of that is death. And that's pretty basic, but that's the truth. And that's 50, 55 years ago. And we can't come to grips with the fact that, you know, we're all, John Kennedy talked about in American University that we all breathe the same air, we all have the same wishes for our children, and in the bottom eventuality, we're all mortal. And it was about nuclear war, but he was saying how we all share this so much in common, and we do. And we can't see the destruction of the universe through nuclear war but in a more micro way. Dr. King was talking about health, not destruction, and that's destruction. And the fact that we can't understand that we should treat everybody fairly and at least give them an opportunity to have health. I've always thought that the first thing any public official should do is provide for people's health care, give them a chance to get a healthy start and to live and to be part of life. The second thing is to try to get them a job. But you can't have a job if you're not alive. The first thing is health care. The second thing is get somebody a job. And then the next thing is justice. And we haven't gotten any of those things together yet in our country. A lot of it's a division of the parties. And the Democratic Party, which has given us Medicare and Medicaid and the Affordable Care Act, cares about giving people a chance, giving everybody a chance to have your basic opportunity at life and health. My proudest moment was the Affordable Care Act and voting for it. My father was a doctor, and I had a pen that my father had. He'd been deceased for 20 years, and there was a pen that said Dr. Morris Cohen on it. And I used that pen, and I held it up on the floor. And I didn't go to medical school, but I did what I could do, and I've always done to try to provide health care for people. We made a big step. Not one Republican voted for it in the House. And now they want to repeal it, and Trump wants to repeal it. We need to keep the Affordable Care Act. We need to have Medicare for all would be wonderful. Healthcare for all would be wonderful. And I sponsor all of that. And Pramilla's great, and Bernie's fine, And Abraham, Martin, and John are even better. But the truth is, we just got to get to where we can get. And I think if Joe Biden's in, we'll get as close to as we could possibly get through the system that we've got. And that might be a public option. We should have had that in 2010, but Rahm and company backed off of it. We've got a ways to go. Everybody should have health care in this country. They should have an opportunity to live and not have differences in life expectancy be based on race and income status and location. We've got health deserts. People don't have access to doctors in the inner city and rural areas too. And that results in lower life expectancies. And then we've got all kind of environmental disasters which affect people's health and reduce their life even more. And brownfields, and we allow these things to go on and try to lift rules and regulations with Trump. Doesn't worry about people breathing in bad air and destroying their lungs and all those things. So it's a hard fight. It's a long fight. And I've learned in my long term in politics, change is evolutionary, not revolutionary. And if we can get a public option, I'll be thrilled to death. If we can get Medicare for all, lower the Medicare age to 55, whatever we have to do, I will take and support every incremental step to eventually getting health care for everybody. We're the last industrial country that doesn't have health care for everybody. Isn't that amazing? The United States of America, we don't have it. Well, it's amazing, but it's not amazing. Because it's not amazing because we're a country that had slavery for 265 years or something like that, and did Jim Crow, which was just slavery light for the next 100 years. And we still haven't gotten beyond that. Some people don't understand the difficulties people have because of race, not having family wealth, families to provide for education, and admission to colleges based on their ancestry, let alone their financial opportunities. Jared Kushner's father made a tremendous contribution to Harvard. Without that, maybe he'd have gone to Montclair State. No offense to Montclair State. Too many people haven't had opportunity. So all of this comes back to the inequalities we have in this country in economics, the inequality in politics, where a large party, the Republican Party, doesn't seem to care about giving people that opportunity and health care and a chance to breathe, live as long as they possibly can. And we see it with the coronavirus. I mean, open it up too early in the red states is basically saying a lot of those people on the front lines, or a lot of those people who've got diabetes or heart conditions and are likely to die, they don't care, because it's about the Dow Jones averages. And it's about the re-election of the most greedy, narcissistic, grifting president that we've ever had and that a Hollywood playwright could ever create. So on those encouraging and optimistic notes, where do we go from here? You're looking at me. Do you want me to, is there something else I should say? Or can you hear me? You can't hear me. Good.
I think, Stephanie, maybe you're still on mute. Would you like me to?
Oh, yes. No, I wasn't trying to say anything. Please continue.
Well, that's pretty much it. I mean, we've got to tell the problem is there are enough Democrats for it. There's the problem of passing some bill because of the fact that we know that it's going to be difficult to get anything passed in the Senate. We can't get anything passed now. And we'll just go for what we can get. And, in Tennessee, we've got TennCare, which is, and a governor before him, Haslam, didn't expand Medicaid. That was absurd. That's the reason the rural hospitals are dying. I heard Governor Lee talk today about how he was giving $10 million to some hospital, some rural hospital. If he'd expanded Medicaid and taken $1 billion plus from the federal government, the rural hospitals would have still been open and maybe take care of some folks and give health care. But because of some obstinance to the legacy of a black president these people can't get over, they're not going to expand Medicaid. They're going to couch it in terms of fiscal austerity and where will the money come from next, and all these other things they may couch it in. But it comes back to a part of America that is eaten up with race and will not. They mimic Trump and trying to diminish and destroy anything that the black man accomplished as President of the United States of America. It comes down to race.
Definitely. Thank you so much for sharing your thoughts, Rep. Cohen. I know that it's been an incredibly busy time for members of Congress. So the fact that you were able to join us and share your insights and thoughts, especially in terms of health policy right now, we really appreciate it.
Well, you're welcome. I'd like to see Wendell. Is he there? Wendell's not there yet?
Oh, he is. He just waved at you.
Yes.
Oh, good. Hey, Wendell.
Congressman, good to see you.
It's good to see you, and it's great to have Bart Sullivan on my staff. It's kind of a Scripps Howard tether.
For sure. It's wonderful.
You've done a great job. I love reading your articles and knowing how good you were. And you remember, did you cover TennCare in some capacity?
Sure did. Yep.
Gordon Bonnyman, guy.
Yes. Yep.
David Kevorkian.
Yep. I know those guys. Yep.
Yeah. Nice to see you.
Good to see you, Congressman. Thank you.
Yeah, thank you so much. And also for highlighting our next panelist, Wendell Potter. We're so excited to have you here. Just as Rep. Cohen said, and just to let everyone know, we have about 38 people on this call. I know about over 80 people RSVP'd, and so we're going to see more people coming in. But for people who don't know who Wendell is a former health insurance executive, and now is the president of businesses for Medicare-for-all. He's also a native Tennessean. He's done some incredible work for the Medicare-for-all movement, especially exposing a lot of the tactics from private insurance. And so, Wendell, please take it away. So happy you're here with us.
Thank you very much. And you're right, Stephanie and Congressman, I'm a native of Tennessee, one of the few people who can truthfully claim to have lived in both Mountain City and Memphis. And many places in between, including Nashville and Knoxville and Kingsport. So proud of the state. I don't know if you can see this, but I've got Tennessee tattooed on my wrist. So I'm a real proud volunteer guy. As Stephanie said, I used to work for the insurance business. Before that, and Congressman Cohen was alluding to this, I was a reporter in Tennessee. I worked for a newspaper in Memphis and then covered Tennessee state government in Nashville, covered the legislature and the governor's office, and then got a chance to go to Washington to cover Congress and the White House and the Supreme Court for Scripps Howard newspapers. But I had a longer career working in the insurance business. I ventured into public relations and wound up in a job I never could have imagined, leading actually two jobs, leading communications for Humana and then Cigna, two of the biggest insurance companies in the country. And I left after a crisis of conscience and became a very vocal critic of the industry, testified before Congress several times back in 2009 and 2010, and was, like Congressman Cohen, very grateful that Congress passed the Affordable Care Act. I've said many times, though, that it was the end of the beginning of reform. It did a lot of good, but there's a lot more work that we need to do, and including reducing the power and influence of my former industry. If there is one industry that is frankly going to be doing quite well during this pandemic, it is the health insurance business. The companies that I used to work for and others have been telling their investors that they very likely will wind up this year with a net savings. In other words, they'll be taking in a lot in revenue, but paying out less money than they had anticipated in claims, and that's because so many elective procedures are being canceled. So they're going to do quite well. They already are. United and Cigna and Aetna and Humana and Anthem announced their first quarter earnings last month. All of them have done exceedingly well. United made $5 billion in profits just in the first 3 months of this year alone. So these companies are just making out like gangbusters. Meanwhile, more and more of us are losing our health insurance. One of the things I used to have to do as part of my job was to defend the employer-based healthcare system. And of course, even during the debates earlier this year, the candidates who were running for the Democratic nomination for president, many of them were talking about our employer-based system and how so many Americans are happy to have their insurance. Of course they are. But one thing that was left unsaid was just how insecure that system is. And we're seeing that play out right now. That system, by the way, the employer-based system, has been crumbling for many, many years. In 1999, there were about 160 million Americans who got their coverage through work. 20 years later, it was down to a little over 150 million. And in that space of 20 years, the population of this country increased by 50 million. So it's been declining over many, many years, but now we're seeing it absolutely collapse. Just in the last 6 weeks, 30 million Americans have applied for unemployment compensation. That undoubtedly will continue to increase for a time. And along with these people losing their jobs, most of them have also lost their health insurance. And the numbers that I just cited, the 30 million Americans who've applied for unemployment compensation, that doesn't really include all the people who've lost their jobs. The Economic Policy Institute suggests that as many as 14 million more might have lost their jobs and either were not eligible for unemployment compensation or they have not been able to file yet. So we've got a system that is absolutely failing an untold number of Americans. And it's something that we absolutely have to give serious consideration to. And I hope Congress will, in the next administration, will take a real look at really just the absurdity of continuing on with a system in which people's access to healthcare is tied to their jobs. Now, it's important to note that the employer-based system is very, very important to my old industry. Majority of the customers of the big insurance companies are not individuals, but are corporations. And so the leading champion of retaining the employer-based system is the insurance industry. So know that as you hear as we go forward in the debate about what to do next, you'll hear the insurance industry in particular continue to lobby for propping up and continuing on with our employer-based system. I wasn't always a Medicare-for-all supporter, but I became one a few years ago after actually talking to a lot of employers, learning from them how difficult it is for them to continue to offer benefits and how, in many cases, many of them are no longer able to do that. The majority of small businesses in this country cannot offer benefits, and that puts them at a disadvantage when they're trying to hire and retain talent. The very biggest corporations are the ones that are able to attract and retain the best employees. And the small businesses and even mid-sized businesses that offer coverage are still struggling to offer those benefits. I got into this, into supporting Medicare for All at the encouragement of a mid-sized employer here in Pennsylvania who was telling me just how much his premiums are increasing every single year by the double digits. So the Affordable Care Act has not been as much of a relief to employers as we thought that it might be. So as I said earlier, I think the Affordable Care Act brought us a long way. It has done a lot of good, but we really need to move beyond this. And there are some things that we need to do, and Congress needs to focus on. A public option absolutely should be on the table to consider once again. But I really think that it's important for those of us who are advocating for universal coverage and for a system that truly does bring down cost and ensures that everyone has access to quality health care, that we need to keep pushing, those of us who are advocates, pushing, I'm going to say it, pushing from the left to make sure that we don't have another situation like we did 12 years ago. And Representative Cohen is right. The people who were surrounding President Obama were willing and did compromise even before the legislation was really being debated in Congress. We can't do that again. We absolutely have to keep the pressure on candidates, on members of Congress, and the next president, hopefully a Democrat, to make sure that we're getting the kind of reform that we really need to move us much closer to universal coverage and a system in which nobody has to turn to GoFundMe or the bankruptcy court when we need care. Thank you. Thanks, Stephanie.
Wonderful. Thank you so much, Wendell. I've always appreciated your incredibly unique perspective, and I'm so glad that we have you on this side now. Such a wonderful use of your talents. So thank you so much. And so I notice people are putting some questions in the chat box for any of our panelists. If there's any questions you'd like to answer, please feel free to do that, engage. For our next speaker, we have Dr. Brenda Butka. She's a pulmonologist and a member of the Physicians for a National Health Program. And she's based here in Nashville. And she's going to speak more about the physician perspective in terms of the benefits of a single payer system and its relation, especially now in the midst of COVID.
Okay, to be perfectly fair, I'm a retired pulmonologist. I just want to be perfectly clear. I don't want anyone to think I'm a hero, all right? But my colleagues certainly have been. I think we all think a lot about universal coverage. We see that millions are not covered now, and many millions more, as Steve Cohen and Mr. Potter have also said, are losing their insurance. So it's very easy, and indeed, the majority of Medicare-for-all, the benefits will come through simply universal coverage that won't lapse between jobs or moving or other problems. But as I've been looking at this, there's some other areas that I think COVID really has highlighted the fragmented and fragile nature of our system, even beyond covering all the individuals in the country. Some of these, so I'm going to talk about, mention just a couple of things, and I'd be really interested in input or information about these things. One, although this perhaps it wouldn't directly be affected by Medicare, I think our underlying public health system, we're seeing the problems there. Over the last few decades, we've lost 60,000 public health employees because our public health system has been systematically underfunded. And we all know that contact tracing of cases would have been a way to perhaps contain this epidemic. And as eventually the epidemic winds down, it should be a way to help keep it manageable in the future. I don't even know if we have the personnel to do contact tracing, effective contact tracing, much less the political will. Contact tracing doesn't do much good if we can't really quarantine people. And I don't know that we have either the personnel or the political will to do that. Our police officers are not even willing to enforce social distancing or masking in many places. So that's Medicare for All isn't an answer perhaps to that, except that if we have a single entity to think about our healthcare system through, I think that would be helpful to apply pressure for some of these other aspects of our healthcare system. So the fragility and fragmented nature of our public health system is a real problem. And then another very bizarre spinoff of COVID is that even though everyone's worried about being sick and the death rate has skyrocketed in many places, as we know, hospitals are firing people or laying them off. Cookeville furloughed 400 employees from its hospital system just a few days ago. Williamson County furloughed 200. And that is a direct result of the fact that hospitals are financed by individual billing and collections. And Medicare for All's, one of the features of the plans that have been proposed is global financing for hospitals. And that's something, again, we don't really talk about that very much, but if you look around, if a hospital had a fixed budget for the year, it could be shifting people instead of furloughing them. Another potential problem, I think, and I think Wendell Potter knows a whole lot more about this than I do, certainly, but as hospitals become more fragile financially because they're not doing all the non-emergent services that they make their money on and can support themselves on, it really sets the hospital system up for more consolidation. So what's big gets bigger. And I think it's fairly well established that big consolidated systems are more expensive. This is not a way to save money. So there's some spin-offs of COVID beyond the horrific individual costs in terms of lost jobs and healthcare coverage. Another area that I've thought about a bit is that it turns out, and I was really surprised by this, although again, it makes sense. The front line, although I was a specialist, I was protected from the front line because I was over at Vanderbilt, and there were several layers of doctors who saw patients before they got to me. But the front line of our healthcare system is our family practices, our primary care practices, and they are failing right now because people are avoiding routine care because of COVID. So by some estimates, half of the family and primary care practices are either cutting way back or actually going broke. And one estimate that I read said that they thought as many as 800,000 employees of these frontline practices would be losing jobs. Now they're not all medical personnel. Some of those are billing personnel and receptionists and so on, but that is a real loss. And we have no systematic way to support our front lines. These people should be supported. We're gonna need more of them in the future as we come out of this, not fewer. And we have no reassurance that the profit takers aren't going to come zooming in and clean up. Again, buying out practices, consolidating practices, making more doctors employees as needed, and so on. And along with that has come a big shift, an abrupt shift in how medicine is practiced. All of a sudden, telemedicine is done like everywhere. And that's probably a good thing, but how is that going to be supported or financed, or how are we going to look at that? So these are problems, some of which Medicare-for-all would directly help. Some of the financial problems of physicians and of hospitals, others perhaps not so directly, but they're things that have surfaced during the stresses of COVID that we need to think about. Anyhow, I'd be very interested to hear what other people have to say about some of these features. So just to recap, the public health system, hospitals firing people and becoming financially fragile, and problems with frontline practitioners, also with fragility, economic fragility. Thank you for the opportunity to speak.
Thank you so much, Dr. Butka. Your experience as a physician and also a member of PNHP is so valued, and you really highlighted a lot of different areas within our healthcare system. And I noticed that there's a couple questions in the chat, so feel free to answer if you guys would like to. So thank you so much. So our last three speakers really just sort of laid down the groundwork of like, why do we need Medicare for all? What's been going on? And for the next several speakers we're going to have, these are the people who have been on the ground in Tennessee and are leading a lot of the actions. And so I'm really happy to introduce Andy Spears, who's the Executive Director for Tennessee Citizen Action and also the Tennessee Healthcare Campaign. Super busy guy. He's going to give us some updates on the Citizen Action and the Healthcare Coalition. So please take it away.
Yeah, thank you, Stephanie. And I do at this time wear two hats, Tennessee Citizen Action, Tennessee Healthcare Campaign. Many years ago, I worked with Representative Cohen when he was a state senator and by far the smartest member of the Tennessee General Assembly, who saw that we needed a lottery to help fund our colleges, which has been great. And we That's worked out really well. So thank you, Representative Cohen, for that. And also want to say, had a great meeting with Representative Cooper back in December on payday lending, which Representative Cohen has been a leader on for a while, but Representative Cooper finally signed on to this year. And so hopefully he will also follow Representative Cohen's lead and join us on Medicare for All. We're going to keep meeting with him. I know Kristen has done a great job, but we're not going to stop putting pressure on Representative Cooper to join Representative Cohen in that regard. So a couple of things. One, especially with the healthcare campaign, we are involved in a project around rural health. Tennessee leads the nation in number of rural hospitals that have closed. There are 14 rural hospitals that have closed in Tennessee. There are about 9 more at risk of closing before the end of this year. So that's a huge crisis. There are 22 out of 95 Tennessee counties have no emergency room. Imagine having the symptoms of COVID and having nowhere to go, or the closest place to go is an hour and a half away. And then you get a surprise bill of thousands of dollars. Some of the work we've done, so going back to my other hat, some of the work we've done at Citizen Action is around payday lending. And I cannot tell you how many people have told me, I took out a payday loan to pay my ER bill. I feel like I owe this hospital back. And so I took out a payday loan and got into a whole other system of problems because I can't afford the medical bill. And here are people who are working, who are making, Tennessee leads the nation, a number of people making, working at the minimum wage per capita. Tennessee leads the nation, a number of people with medical bankruptcies. We have an absolute failure of leadership at the state level. Thankfully, Representative Cooper has been right about pushing for Medicaid expansion, and definitely appreciate that. I have news. I have talked to our legislators. That's not going to happen. I want it to happen, but it's not. So the only way to get healthcare to the rural communities, we had a town hall at the beginning of April in Oneida, which is in Scott County, which is not close to anything. It's 2 hours from Knoxville. It's not anywhere. You can't get there. And the county executives in these counties, Morgan County, Scott County, et cetera, Republicans, conservative people, they don't care what happens as long as their hospital stays open. If it means Medicare for all, that's what we have to have. They are begging Republican legislators to do something, and Governor Lee and others are doing nothing, which means we need federal action. So I'm supposed to be nonpartisan, but we need a different president. And we need leaders like Representative Cohen, like Jim Cooper on Medicaid, to push for a federal solution to this problem. So that's the thing that we're doing, is once we're allowed to have meetings with people again, and that's a possible thing this summer, I hope, we'll be in Johnson City and Knoxville and Chattanooga and in rural parts of West Tennessee talking about healthcare solutions. Decatur County recently just closed their hospital. And, I talked to a woman in the Tri-Cities who was a teacher for a long time and worked for a hospital. Her name was Sharon Brown. Her heart medication costs roughly $1,200 a month. If she doesn't take it, after about 20 days, she dies. That's the choice she has. She has been lucky to get a grant year after year to cover her medicine, but if that grant runs out, there's no more sharing. And I said, well, and she worked for a hospital for years, retired from a hospital, then and also worked in the school system, cannot afford her medicine. And I said, what do you think the answer is? And she said, the answer is Medicare for all. The only way to solve this problem for people like me is Medicare for all. The bill that includes Representative John Paul's bill and Bernie Sanders' bill that includes covering prescription drugs, because people like me can't live, and so she got the grant again this March. She got a notice and she was very excited. Next March, she may not get the grant. And if she doesn't get the grant, there's no more sharing. And that's not okay. You have somebody who worked for a hospital and worked for our school system. And frankly, it doesn't matter who they are. We're all humans, and the basic elements of life should be provided for us. So part of our work is telling that story. People like Sharon Brown, they exist all over Tennessee. And I'm, as an advocate of someone who's done this for a long time, I'm tired of waiting. I don't want to wait for Bill Lee. I don't know how many more, I guess he has 2 more years in office at a minimum. we don't have time to wait for him to figure out that people need health care. So we need a federal solution, and Medicare for All is the clearest path forward. And I think that's all I have, unless people have other thoughts.
Andy, that was fantastic, and thank you for making that very compelling argument. And I think you're, highlighting such an important part that I think Dr. Butka was also referring to. But we can't take care of our rural hospitals and these hospitals that aren't maybe the most profit driven unless we have a federal financing system, right? And so that's the only way we're going to guarantee that everyone, no matter who you are, where you live, has access to healthcare. So thank you so much for that. And we hope that any of the following actions that you just described, that we're going to be able to support that. Great. So for our next speaker, we have Miller Way from Middle Tennessee Democratic Socialists of America. And he's going to tell us about some of the efforts that he's been pushing forward in terms of city resolutions and also in terms of signing on Rep. Cooper. So please, Miller.
Thanks, Stephanie. Hi, folks. So I kind of wanted to start by addressing some of the questions I saw come up in the chat box here. A lot of the other folks have done a great job of explaining the whys of Medicare for All, and in ways that I think they're far more qualified than I am. And luckily, some folks have already answered some of these questions, but people asking about what we can do. I got involved in politics in meaningful ways pretty late in my life. Well, relatively. I guess late in life is relative to who's saying it. I joined the DSA when I moved back from China several years ago after living abroad. And I had, from that time I'd been voting abroad. I've kept up with politics, but it wasn't until I got involved with the DSA that I really started being a part of politics, not just voting, but making my voice heard and organizing with other folks. Politics, if it's just a spectator sport, if we're just showing up every 4 years or every 2 years, we don't get anything done. It's going to be hard to beat the donors. Folks in the chat have made a really great point that donors are putting a ton of money on this. These people, the reason they're as wealthy as they are, is because of this unequal system we have that exploits people and leaves people behind. But where we have power is people power. We have the numbers. Something that one of our sister chapters, so the Democratic Socialists of America is a national group, but the local groups are, they do a lot on their own. They are tied to the national organization, but a lot happens at the local level. The Austin DSA chapter, they managed to get their representative Lloyd Doggett, who was initially not a co-sponsor of the current Medicare for All 2019 Act, HR 1384. They worked really hard to pressure him into becoming a co-sponsor. It's something that can be done if we work together. Stephanie mentioned the city council resolution. So Public Citizen has this amazing campaign getting folks all around the country, getting their city councils to show at a legislative level the support that Medicare for All has all across the country. We have one of our members on the city council, Sean Parker, and we have been discussing putting this forward in Nashville. One thing that shows nationally that we have the support in Nashville, that we believe here in Tennessee in Nashville, that healthcare is a human right and it's something we deserve. It's also a way to put pressure on our representative, Jim Cooper, who has unfortunately not signed on to the Medicare for All of 2019 Act yet. We are looking at also including a financial statement in ours to show how much money this can really save the city. Nashville, especially just the 1-2 punch we've had with COVID-19 happening right after these tornadoes. Those of you who aren't here in Nashville, we had some terrible storms that did a lot of damage, knocked electricity out for a lot of people. So this city budget has been strained. And this is something that just from a very practical financial level is extremely helpful to the city of Nashville if we were at the national level to pass Medicare for All. So We've done town halls locally. We've had people like Dr. Carol Paris, who was former president of the Physicians for National Healthcare Plan, who also was a big part in getting Representative Cooper to sign on to the Improved and Expanded Medicare for All Act, which was the previous act. But we want to get him to sign on the one now because we believe that this needs to happen now. We've had a lot of conversations with Nashvillians locally with canvassing. Dr. Butka actually joined us some months back when we went door to door and talked to Nashvillians about why we think this is important. So right now we're having to adapt things to the age of COVID-19. We're not able to go knocking door to door. We're not able to do some of the things that we were able to do before, but we are currently organizing a phone and digital contact campaign. I'll drop my URL in the chat. It's pretty easy to jump on. We have a script. We have the contact methods for Representative Cooper. This is something that if you're based somewhere else and aren't lucky enough to have a representative like Representative Cohen who has signed on, you can also use some of the materials that we have for that. I'll be dropping that here in just a minute. But it's a great way to show your support individually, but also be a part of something. And if you have friends and family, having those conversations about why this is important. I don't think I can, you don't need to hear me rattle off the same things these folks have done much better than I could. This is a conversation that any of you can have. I feel so much more informed than I was months and months ago. Just coming to calls like this, paying attention, asking questions, and being a part as much as I could. So I would encourage everyone to, if you can, be a part of this effort. Give Representative Cooper or your own representative a call or a virtual contact. You probably don't want to use their DC offices. Long story, use their local offices. And talk to your friends, talk to your family. Because there are a lot of people who might just be a job loss away from not being able to afford vital medication, or an operation or a bad diagnosis away from something they can't afford even with their employer stuff. So thank you. And I'll let it get back to everybody else.
Awesome. Thanks so much, Miller. Now, I remember a few months back, we had a sort of Medicare for All training, and you were there, and we did like a FAQ, and you knew all the answers, and you were so great about talking about it. So Miller's modest, but thank you so much for sharing about a lot of the work that you're doing and how to sort of, relearn how to organize in the midst of COVID. So thanks so much for sharing. So for our final local advocate, we have the inimitable Kristen Grimm, who is the founder of Moms for Medicare for All. And if you haven't seen a picture of Kristen, I'm not sure which picture you're going to show, but she has been doing some incredible on the ground work. And so I'm really excited for her to share what she's done and what we're hoping to do with her.
Thank you, Stephanie, and thank you to all the panelists and for all of your advocacy. Thank you for everyone watching today. So I'm Kristen Grimm. I'm the founder of Mothers for Medicare for All. And I like to tell people I'm also the mother of one of the bravest people I've ever known. So for some of you who don't know, one of our sons has had 24 surgeries in his lifetime. So I like to tell people that I'm literally living through what I'm fighting for. And like many of the advocates on the call tonight, I got my start in advocacy and doing the good fight to fight for Medicaid expansion. But also I was one of the moms that helped protect and preserve the Affordable Care Act. Our family has also started our advocacy, me specifically. I guess originally I started my advocacy on the floors of children's hospitals. I have had every kind of insurance for our son, as you can imagine, with 24 surgeries in his lifetime. We've had a lot of healthcare needs and a lot of bills. And so I've been an uninsured mother. I've been an underinsured mother. During the Great Recession, our family lost healthcare during a time when our son was very, very sick. And we racked up bills at our local children's hospital and almost lost everything because of it. And so throughout the years, we have learned where every level of healthcare that we've had for our son, essentially we've been underinsured, and everything has been a fight every step of the way. I'm in my house right now, and behind this wall is my kitchen, and in that room is when I decided to start Mothers for Medicare-for-all. I had been learning about Medicare-for-all and really come to the conclusion that we need a strong federal solution. But I was standing in my kitchen during my son's 23rd surgery, and I realized that that we were fighting so hard. I'm sorry, I was standing there for my son's 24th surgery, and we had been fighting with our employer-based insurance to get him across the state lines for care, and literally trying to get a surgery that he had had 6 months prior. We had to fight so hard, and I just said, enough is enough. We cannot keep fighting our employer-based insurance like this each and every time. And I just really came to the conclusion that the underinsured children in this country, the uninsured children in this country need advocacy, and moms are a powerhouse. So Mothers for Medicare-for-all is an organization that is committed to seeing guaranteed healthcare come to all of us. We are the only advanced nation in the world where we have uninsured children and uninsured individuals. And we have so many children have lost healthcare. Even with all the strengths of the Affordable Care Act, we still have uninsured children and underinsured children. So what we decided to do is to just go where we can move this legislation forward. And we realized that in Congress with the Medicare-for-all Act, HR 1384, we noticed that there were a lot of representatives in the country that had supported Medicare-for-all in 2017. And then when Pramila Jayapal, that was HR 676, and when Pramila Jayapal came around with a new and improved piece of legislation in 2019, we had representatives all over this country that had supported the legislation, Medicare-for-all in 2016. And then when it came time in 2019, they decided they weren't going to support it. So we took an inventory, and Representative Jim Cooper is in Nashville, and that's where we have headquarters. So we decided that we were going to take action. And starting on October 4th, we started standing in front of his office with signs calling on his heart to form a federal final solution for all the things that, all the problems we have in this country with healthcare, all the inequity, all the inadequacies. And so we stood there starting October 4th, and we called it our Friday Action. And we stood there every single Friday for 19 Fridays. And let me tell you, I don't know why, but for some reason, it really likes to rain on Fridays. We were joined with our national partners, Physicians for a National Health Program. Dr. Carol Paris stood with us many days, and we just walked back and forth. And we stood there with love and respect, and we called on him to sign on to HR 1384. And so we're still waiting, and so we would love to see Representative Cooper sign on. We like to see all the representatives across the country sign on to Medicare-for-all, especially those representatives who supported HR 676 but have not signed on to HR 1384. Mothers for Medicare-for-all, we believe healthcare is a human right, and we do not believe that healthcare human rights have expiration dates, and we believe that human rights are human rights, and the only eligibility requirement for someone to have the right to healthcare is that they have to be a human being. That's it. And the way we base healthcare on means testing and eligibility requirements, it is literally breaking down the foundation of our healthcare system, even even on the children's hospital level. I had a very profound conversation with my son's lead surgeon, and I asked him, I said, what is the main problem you see with our healthcare disparities? and the for-profit system running our healthcare systems today. And he just said that, you know, his biggest issue is we're impeding medical discovery for kids. And that really hit home, because that means because he has a very hard time getting kids across the state lines for care, there are all kinds of gaps. It's very hard for him to do best practice. When he goes to do best practice, what does he have to do? He has to call an insurance company and ask permission. He has to call a state Medicaid program, ask them permission, whether or not he can treat a child according to his best practice. So Mothers for Medicare for All, we are in it for the long haul. We believe in calling our leaders to accountability, and we believe in calling our leaders to be consistent. And Representative Jim Cooper has publicly said that he believes that healthcare is a human right. He said it, I believe, in Dixon, and he was very, very sincere in what he was saying, but we need him to be sincere in his actions. And we believe that, you know, we agree with him. He likes to talk about Medicaid expansion a lot, and we so agree that the state needs to expand Medicaid. I happen to agree with Andy Spears. I am not sure, and I seriously doubt it's ever going to happen. So we need a federal solution. We need all of our representatives who say that healthcare is a human right to sign on to HR 1384. It is the only way we're going to have guaranteed healthcare without barriers for everyone residing in the United States. And our kids need this. So we are the only advanced nation in the world where we have parents who have very sick children, where children's hospitals are turning parents into collections. So I want you to think about that. In fact, I think that every executive of every healthcare corporation in this United States should have to work in collections for an entire year. Just take the time off from being the head of your corporation. And I think that they should have to call parents who have very sick children and tell them how much money they owe a children's hospital. I think it would change a lot of things. And in going forward, of course, with COVID-19, our Friday actions have had to come to an abrupt halt. And so what we're doing on Fridays is we are encouraging everyone, we put a graphic out every Friday, so follow us on social media, to look to see if your representative is on the list of supporters for HR 1384. We want to give a huge shout out to Representative Cohen. We're so grateful that you've signed on to HR 1384 and that you're putting the fact that you believe healthcare is a human right into practice. And so we send out a graphic typically on Fridays, and we encourage people to call and email their representative if they have not signed on to HR 1384. And of course, if your representative has signed on to HR 1384, please thank them. But the main deal with Medicare for All is that if we can't move this through Congress, we aren't going anywhere. So we believe in laying the tracks to move this through Congress, get our representatives to hear from us, especially from mothers who walk the halls of children's hospitals with their very sick kids, taking care of our kids, of our really sick kids like my son, who will probably need 100 surgeries in his lifetime, that we are told. It shouldn't be this hard to just simply take care of our kids and make sure that they don't suffer in life without healthcare. And so in closing, I just want to say thank you to everyone, and follow us on social media. And we are moms who believe in action. And so we look forward to just working with our partners throughout the year and going forward to see how we can move this legislation to a path of victory and for healthcare for everyone.
Thank you so much, Kristen, and thank you for highlighting the need for us to not only have our representatives actually represent what our needs and wants are, but also, you know, the people who are already on Medicare for All, on HR 1384, to become more champions for the legislation. So I know it's already 7 o'clock. I ask everyone if you could just stay on for a few more minutes, because this next part is going to be really important. And we're going to have first Melinda, who's going to talk more about the Public Citizens Medicare for All campaign. And then I'd love to just go through some concrete next steps for all of us, and really, you know, dive into what we can do in terms of this movement. So please, Melinda, go ahead.
Great. Well, thanks everyone. And I will be very short. What I wanted to just share with folks, I think what we've learned is that there's already so much exciting things happening in Tennessee that folks should plug into, and I want to give time for that. I just wanted to let folks know that this is part of a national movement, and that the work that's happening in Tennessee can plug into a large coalition effort. And one of the things that we're helping to organize and coordinate are these Medicare for All resolutions, like Miller was talking about in Nashville. And I just wanted to point out this website that has some resources that could be helpful for you. It's Medicare-for-all Resolutions.org, and it has a step-by-step toolkit that for activists that you can, if you want to get started in working in your local community. You can go very, very local. The tiniest town to the biggest city is where we want to be doing organizing, and there's opportunities to do that. So I wanted to point out that toolkit, and also point out there is a map of all of the of efforts happening all around the country, and there are more than 300 efforts underway, and including some in Tennessee, but we'd love to add more to that. So you can sign up there, and we'll put the link in. So if we can help connect you to activists that are close by, or support you as you are, if you want to get started. So I just wanted to point that out. And then the last thing is that in this kind of COVID time, and I think what Kristen is saying is very true. We have to be creative. We're not able to do a lot of the things that we would have been able to do before. We have some new COVID-19 resources and talking points. So this is a good time to do letters to the editor, write letters to the editor, op-eds in your community, where we can really make the links of what COVID is showing about the pitfalls of our current system, and other ways that folks can to get involved and engage. So I just wanted to point those out, and really excited to support any of you, however, in your local organizing, however we can. So I'll pass it back to you, Stephanie.
Great. Thank you, Melinda. I really can't express how grateful we are in Tennessee to have public citizen support and organizing power. You guys are really set such an example for us. And so thank you for all of our speakers. I mean, really, I hope everyone that's participating in this call, you're really seeing that, one, it's very clear the issue here in terms of our healthcare system, and clear also what our solution needs to be and what we should be demanding. But two, that there is a lot of energy and potential and action right here in Tennessee to really move the dial in a lot of different ways. And so I'd love to just invite everyone here to join the movement. You obviously came onto this webinar through an RSVP link, and we'll be sure to follow up with everyone in terms of the information. But we would love for this to be a regular thing. And so I think before I dive into what that format is going to look like, today we heard a lot about mobilizing calls and letters to Rep. Cooper's office in the coming days and weeks. And so we'll make sure that in the follow-up email, you're going to have everyone's contact information who has spoken to engaging in specifically efforts towards contacting Rep. Cooper's office. If anyone is nervous about being able to talk about Medicare for All, I know for me, even as a public health expert, when I first came into this space, I genuinely didn't really know what Medicare for All really meant. And it was really hard to talk about. And so part of that is to actually start these education campaigns through this platform. And so we're going to hold, I think, either weekly or bi-weekly education sessions where we can just talk through talking points. How do you answer all those questions? How do you answer that? How do you pay for Medicare for All? Or what is Medicare for All? And, is it socialism? And being able to battle all of those sort of industry talking points, and being able to have that conversation at Thanksgiving, feeling comfortable being able to combat any of those questions. And so we're going to be holding those regularly, and we'll have different speakers be able to help on that. And then also, really, I think an action I'd like to propose, and I'd love to hear what all the other panelists are thinking, love to invite Rep. Cooper to have a healthcare town hall, and specifically on Medicare for All, and have him either host, or we can host, and he can come. But I'd love for us to have that in June, and leading up to the primaries. So I don't know if anyone else, any of the panelists would like to plug in any other concrete action steps. Well, I know I've said a lot. We'll make sure this is all emailed out to you. But would anyone else like to say anything?
I guess just briefly, Kristen had a great point. Follow us on social media as well, Middle Tennessee DSA. But there's also organizing going around. I saw some folks asking about the Healthcare Emergency Act. That is something I would say definitely those two are separate messages when you're calling your reps, but it's absolutely something that we need to be reaching out to our representatives on. I can drop another link in the chat. There was a recent DSA coordinated call for people to call their reps. There's a script you can use. You could also drop that script into a digital form. But again, it's about people power. You do it, you get friends to do it, you get family members to do it, and that's how we make change.
Amazing. Thank you so much, Miller. Yeah, that would be super helpful. And also I've been seeing in the comments here, yeah, Representative Cooper has not been holding town halls, which is a shame, really, especially not on healthcare in the midst of a pandemic. And so I agree, and I think we should absolutely invite the other candidates who are currently primarying Cooper. Is there any hope trying to get other Tennessee representatives to support HR 1384? Currently, Rep. Cohen is the only one, but I am all for trying to, encourage others, and also state reps. I think our state reps and senators should also be participating in that conversation, and trying to get them to be more explicitly endorsing Medicare for all.
And I would just jump in there, and I think that's where the local resolutions can be a powerful tool for if you're in a district where you're unlikely to be able to convince your representative to sign on now. It's what's important is to build the movement in the meantime, and so contacting your local officials can be a way to build that movement locally, so that because no matter, we know that this is not something that's happening in the next few months. We have our work cut out for us, and there's a lot of the education work and the movement building work is just absolutely critical.
Absolutely. So thank you all so much. I know I took you 8 minutes past. Please forgive me, but please go enjoy your evenings, have dinner, please rest and take care of yourselves in the midst of this. I know it's incredible that every advocate on this panel right now, I mean, they are working tirelessly day in, day out, definitely living at a work situation. But I hope we all can take care of ourselves and take care of each other through this so that we can do this for the long run. And so a lot of resources have been dumped into the chat. We'll make sure that they're in an email format. We'll get this all out to you. And we look forward to seeing you all soon and expanding this out as far as we can. So thank you, everyone. Thank you. Have a great evening. And thank you to our panelists. Y'all are amazing. Thank you. Thank you.